Okay, this is a chronic fungal gastritis. I was going to say redone thing, but who knows how that works actually. Okay, turns out this girl was seen back in March, and in March she had the macrorhabdis type organism, the large fungal yeast, and this time her stools are back to small again, very small for a rabbit, and actually a little bit on the soft side. It turns out that then she was seen again, and we put her on some antifungals, and she did fine for about 6 months. But we never got a recheck, so we weren't sure exactly how well the organism will respond to medications. But we did get some improvement. Then we saw her back in June, and in June she came back. She was supposed to also come back for a 2-week recheck. Never came back. But at least the medication we sent last time gave her about 2 months. And again, we're back to the small stools and stuff. Oh, and her last time she was in, she actually had some a fungal disease on her skin. So we need to assume that she really is kind of susceptible to fungal disease compared to my other 100 rabbits out there, as far as patients and stuff go. It's got more than 100. Anyway, so it turns out that this is where we're at today. Her hair is a little bit on the rough side. She looks like she's basically about a 2 out of 5 on her body score. Her eyes look okay, not too much of a problem. Her ears are clear. Her nose is clear. Her lungs sound good. I will say that probably the reason she's running around the house and acting crazy is because she has flatulence, a lot of gas in her intestine, and that can be kind of painful and crampy. So she's probably just either one, being propelled across the room from the gas that's escaping, or two, the pain is enough to make her want to run, and or it could be the smell. Who knows? I was expecting more laughter out of you. Anyway, but we definitely want to see him back in 2 weeks. Say it out loud. 2 weeks.
2 weeks.
All right, good man. And we'll see how well this stuff is working. Again, some of these organisms can be a little resistant to the fungi, and we don't want to take too much of a chance when it comes to fungal disease. We have a million different antibacterials to treat bacteria with, and there are really only a handful of superbugs out there that are a pain in the butt. When it comes to fungi, we only have a handful of drugs to work with 1,000 organisms. So we want to make sure we get it under control as best we can. Okay. We've also talked about modifying the diet a little bit better. They've actually done a good job, but they still had them on the pelleted food, which is where most of this stuff comes from. Not that this isn't normal in the environment, but once they start making the rabbit food and letting it sit overnight inside of its silage elevators, that's part of the fermentation process, and where a large portion of this fungi comes from. Anyway, that's this case for now. Again, we're rechecking how long?
2 weeks.
Good man. All right, I like this case already. Later. Alright, here we have a fecal from a small rabbit. We have a species of macrorhabdis, or a type of macrorhabdis anyway. It's you can see it chronic. This guy was seen back in March, and we had sent it home with some rather strong antifungals. It gave us about maybe 6 months of relief. Then it came back in June with the same problem again. It was supposed to come back in 2 weeks to make sure we got this under control, and it never did. So we'll help you see how to treat this again. So when your doctor says bring it in for a recheck, that's what he means. We sometimes have a hard time getting these things under control, especially if we don't know what we're doing is working. So recheck. All right. Get some more pictures of some yeasties. Later.